Hey guys, this is Jamie with ICE Magazine, and I'm bringing you another live update from AHRA 2019. And look who I found, one of my favorite people to interview. This is Larry, CEO with Summit Imaging. I'm excited because, Larry, I know off camera we've been talking about some exciting developments that Summit Imaging is bringing to the industry, a new initiative with some of the videos that you're doing. We're going to talk a little more in a minute about how you can find these videos, but tell me about this new initiative. What is it going to mean for our industry?
Well, what we've been doing is working very closely with the largest healthcare networks all over North America.
Right.
And in the business that we're in of ultrasound support, mammography support, especially in those ultrasound transducers, trying to better understand how the damage of these transducers are being incurred throughout the life cycle of the equipment. So we've actually been able to partner with a lot of healthcare facilities to really dive deep and analyze how the damage is occurring on T probes and even just standard probes, and kind of looking at a different optic than just clinical engineering. So our customers are clinical engineers, extraordinarily educated on how this occurs.
Right.
However, sterilization, maybe the use by the sonographers, making them aware of the vulnerabilities of the equipment on where it's damaged, helping them understand how to prevent that damage in the future to really elongate the life cycle of that probe. So if you look at really the life cycle of the piece of equipment, looking at every single phase and every single stakeholder in that process and educating every single audience. And so therefore, we're developing white papers, we're developing videos on how to, things on how you carry a T probe, to how do you store a T probe, to how do you inspect a T probe right before use, so right before sterilization, right after sterilization, to see if they can have some identification of these small failures that would result in a small repair instead of letting it sit and then turning into an unrepairable that would force a full replacement, which is much more expensive.
So education for small steps along the way. I know that Summit Imaging has done a great job of reaching out to clinical engineers. I'm hearing now we're also doing some education for the sonographers. So as they're using it on a daily basis, they can start to recognize some of these issues, call in the clinical engineering department, maybe get smaller repairs, like you said, before it's a bigger problem, correct?
Yep. And the small repairs, they're simplistic, they have very high yield of success, and they're quick, so your downtime is very small.
Faster, I like that. And you mentioned something I want to touch on, white papers, and we've done some promotion for a recent white paper that you did that ties into the impact of transducers in the industry, the repairs of the transducers in the industry. Tell us a little more about that white paper that you've released.
So that white paper was actually written outside of our initiative. That was actually a white paper that was written by Carolyn Coughlin and another expert sonographer in the field. And as they were working with us on doing some research projects, analyzing image quality, they were extraordinarily surprised and disappointed of the difference in image quality as they went through their analysis of comparing a good OEM crystal that is really the bedrock of the image quality of a transducer relative to a counterfeit one. And so they wanted to let their community know, of sonographers, of what are the differences and what did they find. And they found that there was degraded image quality in the counterfeit transducers that should not be there. So for us, we're really good at image quality, but when you bring in a sonography professor and a chair of this, one of the best sonography schools in the nation, they're doing these research projects which resulted in this paper for them to educate their community, which is the sonographers, on why it's not good.
And this is helping you with that two-pronged approach now, sonographers and clinical engineering.
So that really opened up our periphery of education of these expert sonographers are telling us, we need to know this because we don't know. And now we want to go educate them to bring the users of the ultrasound equipment closer to the engineering, because they have to work together to really get the next level of equipment failures to be prevented.
I love that you're helping foster this relationship between the two different departments. And the other white paper touches on something you mentioned, the counterfeit crystals, which is something you and I have chatted about now for at least 12 months, if not more. Tell us more information about that white paper.
That white paper is about, how the second white paper is about how it's really hidden inside these transducers.
Yes.
So what's occurring out there in the open market is that healthcare facilities think that they're getting their probe repaired, or they're buying a probe, a replacement probe, and that it's good.
It's
well,
not.
It's not. There's instances where the original crystal that was OEM is being replaced by a counterfeit crystal.
Right.
And not being disclosed to the end user or the buyer, and it's being sold as an OEM probe.
What are some ways that I could make sure that I'm preventing these counterfeit crystals? Is it making sure I'm working with certified companies, researching reputation?
I think researching reputation as of the moment is probably the best way of doing it.
Good.
First and foremost, ISO 13485 should be a requirement.
Exactly.
And then on top of that, you need to dig a little bit deeper, because ISO 1345 also points to that the repair or manufacturing activities must be compliant with current federal regulations.
Right.
And there's actually regulations. If you look on our website, even some of our videos on our YouTube channel, we talk about how do you know if these are certified with a 510K. And we have more information about that, a little bit different topic, but really having to do your due diligence on the companies that are repairing the equipment and how they're repairing the equipment. And a good old site visit and a sift through their QMS, and then reconciling the regulations against that QMS is really important.
Making sure that you're using the right solution provider.
Interesting on our conversations, the FDA did release a guidance document only a few weeks ago.
That's right.
Which restates exactly what we've been saying the entire time through our YouTube channel and our white papers, is that if you put in a counterfeit crystal, it requires a 510K. I mean, they were very clear about that on the guidance. So healthcare facilities, if you suspect that there's counterfeit crystals in there, do your due diligence and go back to the companies that put them in and demand an OEM probe from them.
Well, let's get our viewers to your website and to your YouTube channel. The website is mysummitimaging.com. Check them out. Lots of information on all of the modalities and services that they can provide for you, more about their reputation in the industry and why you need to check this company out. But I want you to subscribe to their YouTube channel. Can you share the YouTube URL with them?
youtube.com/mysummitimaging.
And I'm going to put that in the comments below, so it's an easy link for you to get over there. But if you're at AHRA today or tomorrow, stop in the exhibit hall. Make sure that you're going to visit booth 522. Talk to my friend Larry. We've got Kyle and Jessica here as well. They're happy to go over any of your questions and tell you more about this company. Larry, it was great to talk to you today.
Thank you.
I enjoy it. All right, guys, we're going to come live in another hour. See you soon.